Hi, welcome back. Here I am with an high yield topic, that is a comparison between an airway and a circulation problem. How we can just do a simple comparison and remember these points in mind before just going through a question which is of a airway or a circulation problem type. Here, I'm going to say regarding a comparison between airway and circulation. In airway, we should always prioritize. If the airway is threatened or it is obstructed, then it is the first priority. So if it is obstructed, we have to see for clearing the airway, or if it is threatened. So we should always manage this first. And in case of circulation, priority when blood flow or perfusion is compromised. If there is a problem with the blood flow, example a heart attack, or a perfusion which is compromised is just because any deep cut where there is no further perfusion to other part of the body, so this comes under priority, such as heavy trauma. And again, a second point is patient can't speak and choking, or he is having a stridor, it comes under the airway problem. And in case of circulation, if the patient is having bleeding, he's having significant hypotension, and he's having a pulselessness or an arrhythmia problem, this comes under priority when comparing with an airway problem. Next, the third point under airway is if there is an obstruction in the airway, example a tongue obstruction, or a collection of vomiters, or any obstruction by a foreign body, then this comes under the priority. And in case of circulation problem, if there is a severe hemorrhage, the patient is having a significant shock, which can be seen by the pulse and the heart rate, and if the patient is going for a cardiac arrest, then this is coming under the priority. And coming back to airway again, if you are hearing any gurgling sound, or if there is a snoring or any hoarseness in the voice, then the airway is the priority. And similarly, in assessment, when we are seeing with the circulation, there is a significant decrease in the BP and significant increase in the heart rate, or weak or an absent pulse, it stands always under priority. Next one, in under airway, low SpO2 because of airway cannot enter, then this falls under emergency. So this has to be treated first. And similarly with circulation, though there is a normal SpO2, there is a poor tissue perfusion because of trauma, this comes under priority when compared to airway. And next is the interventions. What we have to do in an airway problem is we need to suction, we need to jaw thrust maneuver, and you can use the help of airway adjuncts such as airway, laryngeal mask airway, or a normal Goodell airway. All this can be used in case to relieve the airway and clear the airway and to help the patient in breathing. In case of circulation problem, we can do the interventions such as CPR, defibrillation, and we have to resuscitate with the fluids and blood products, or if required, we can give inotropes. These are all the intervention which is coming under the circulation. Where in case of airway again, oxygen helps if only the airway is open. So airway is patent, then only we can do an airway problem to get it cleared. And similarly, when compared to the circulation, oxygen is useless until there is not an established circulation. So regular and established circulation is much essential before the oxygen to be supplied. Here, in example with the airway problem is if the patient is unconscious, patient is having an obstructed airway, these stands under priority. And similarly with circulation problem, the patient, though he might be talking, patient is very low, though he looks stable, but he might be having a massive GI bleeding. So this always stands out under the highest priority. So the Nclex keyword, what we should remember in airway is if the air cannot get in via the airway because of block, obstruction or anything, then it is the highest priority. And the Nclex keyword under the circulation is blood is not moving out, then it is the important to be noted in circulation problem. Here the patient dies in airway problem is just because of hypoxia, and In case of circulation problem, the patient dies because of ischemia and severe shock. Okay, these are the few things we need to remember when you are seeing the questions under this headings. So I hope this small hint is helpful for you to see which problem is more priority in selecting and choosing the correct options. Thank you and happy learning.